In this month's Milk SA interview, we've asked Dr. Mark Chimes to join us to talk about brucellosis. Now, he is the chairman of the Brucellosis and Tuberculosis Steering Committee for Milk SA. Mark, thank you for joining us. What is brucellosis exactly and why is it so important?
Thank you, Lisa. Brucellosis is a bacterial disease, and in animals it is known as contagious abortion. And in humans, it causes a disease called Malta fever. And the reason it's important is because it's transmissible to humans, so it has human health implications. And then obviously it causes production losses on the animal side, so it has financial implications for the farmer.
Mm-hmm. So how do people contract it, and what are the symptoms?
In humans, the most common route of infection is through consuming unpasteurized milk from infected animals. If the milk is pasteurized, sterilized, or boiled, it's completely safe to consume. And it can also be contracted by coming into contact with infected materials such as aborted material or the fluids from during calving, etc. And you must also be careful when vaccinating cattle. That's a live vaccine. So if you prick yourself by accident, or if the needle comes loose and you get splashed back in the face and it gets into your eyes or mouth, you can contract it through the vaccine as well. Mm-hmm. So very important to wear protective clothing.
What about the animal? How do they get the disease?
Although it causes abortion, and although it's known as contagious abortion, it's not actually a sexually transmitted disease. The cows get it through ingesting the organism from the environment. Mm-hmm. Normally, when a cow calves and they secrete millions of these bacteria into the environment, and then if a cow goes and then licks on the aborted fetus or the placenta, or even eats the grass where the cow has calved, and it's contaminated grass, they can consume it, and they take it in by mouth. From there, the bacteria then moves into the lymph nodes, where it remains dormant until the cow is pregnant, and then in the last trimester, it then moves to the uterus in huge amounts. And when the cow calves, she then secretes lots of these bacteria again into the environment. And they also secrete it through the urine and in their milk, so the calf can get it from drinking milk from an infected cow. Some calves are infected in the uterus, so they actually get born with the disease as well.
Why is it such a difficult disease to control?
The reason is because the bacteria moves into the cells. Once it gets into the lymph nodes, it moves into the cells where it remains dormant. And because it's in the cell, the immune system doesn't pick it up. So as a result, the immune system can't get rid of it, and they also don't produce antibodies. And that makes it a difficult disease then to detect as a result, because the way we test for them is we test the serum for antibodies and to determine whether a cow had been exposed to the bacteria. And so if she's not producing antibodies, we might think that she's negative when in fact she's harboring the disease because it's dormant. And then once she calves or aborts, she secretes lots of these bacteria into the environment and then contaminates the environment and several other cattle in the herd as well.
So how do we control it, and how do we get our herd disease free if they do have it?
Well, you must understand that brucellosis is a herd disease. If one cow in the herd it tests positive, then the whole herd is considered positive for the disease. And the reason is because there could be several other cattle within the same herd carrying the disease, and you test them and they test negative and they give you false negative results. So it's a disease that hides very, very well, and you need to be very careful of bringing animals into your herd. The most common way for herds to become contaminated is by buying animals that actually carry the disease, and so the farmers actually buy their problem. Mm-hmm. They pay for it, and so you must only buy from herds that have been certified free from brucellosis. That is the herd, not individual animals. If a farmer comes to you and saying, no, I've tested these cows, they don't have the disease, doesn't count. It's got to be a state veterinary issued certificate. And the only way to really control the disease is to then test the herd. All the positive animals must be slaughtered. They may not be sold to anybody else. They may only go to abattoir under a Red Cross permit. And the only way to prevent the disease is A, don't buy in animals if you can prevent it, and vaccinate, especially your young heifers. So between 4 and 8 months old, you vaccinate them with S19, and then about a month before they're due to go to the bull or to be inseminated, you vaccinate them with RB51. Do not vaccinate with S19 vaccine if they're older than 8 months old, because they will test positive on the blood test. You only use RB51 in those cases. And then you can, if you've got brucellosis in your herd, you can obviously give them an annual booster with RB51. And I would say if you're going to do nothing else, at the very least, just vaccinate your heifers. It will go a long way in preventing the disease from establishing itself within your herd and from spreading from there as well. And do not vaccinate bulls of any age at all. If you do vaccinate bulls, then they are likely to become infertile as a result, because it will cause inflammation in the testes.
Vaccines are available. There's enough.
For animals, yes. Yes, certainly.
Yes, let's talk about the human. Are there any vaccines available for human? I mean, how do we treat this disease?
No, unfortunately for humans, there's no vaccine available. The disease can be treated with antibiotics. It's normally a course of 2 or 3 antibiotics concurrently at the same time for up to 6 weeks. The problem is in humans that the disease, if you do get it, it causes symptoms that's very similar to flu. So you get aches and pains, you get headaches, fever, etc. So you don't always realize that you've got it. Some people can get rid of the disease without any treatment. Other people will not get rid of it despite the treatment, and they will carry it for life, and then they will have these recurrent bouts of fever and aches and pains. And it's a seriously debilitating disease, and it's important that you try and prevent this disease and also eradicate it from your herd to protect yourself, your family, and your farm workers, as well as your finances in terms of your herd production. Ignoring the disease is a false economy.
Well, you know all about it. Thank you very much for joining us. Dr. Mark Chimes from Milk SA, talking to us about brucellosis in humans and in cattle.